There's a large activation when we image something, particularly if we're imaging some type of movements. And then the same activation, similar activation, when you physically produce those particular skills as well. All right, so that kind of gives us a rationale. So it seems like memory, there's some neurological basis for the benefits of using this particular skill. I'm going to end on this. So this is kind of really my last slide here in terms of best practices. And I always kind of struggle with this slide because really, in order to use this, if you feel like, oh, I can maybe get this to my athletes, it's not good enough just to say, go ahead and image this. Because oftentimes what happens is, this is a skill. And to me, when I introduce this, some people are naturally really good at it, and they don't need to practice it. But I would say 80% of the people that I end up working with, they have to practice it. Like anything, if you're going to shoot free throws, you don't just do it once and say, oh, okay, well, I kind of get it, and then I stop. You have to do it over and over and over again. I now tell my athletes who incorporate this into their practice to do it daily. Take 5-10 minutes. You have to do it daily. If you do it daily, you're going to strengthen the skill. You're making it a lot easier for you, and it's going to be more of an adaptive skill for yourself. So with that, one of my bullet points, and I kind of always harp on this with the athletes that I work with, practice. Start slow, do something easy, take something that's very familiar with you, like an orange or a tennis ball, kind of a static thing, simple, practice just kind of re-experiencing that, and then build up to more complex images to where you can then be more, come up with some complex stuff that would be associated with your sport or what you're trying to do in terms of learning a particular skill. Theory-based imagery interventions, I think it has to be based in theory. It can't just be like, I read articles and it's like, oh, we had an image. Well, what did you have in that image? I mean, I can tell someone to image something, but we can't really watch that. I don't know what's going on in your brain when you image something. So we want to really walk them through using the theories that we just talked about to make sure, okay, what's the situation you want to image? What's the scenario? Tell me about that. Make sure that they can kind of clearly articulate what that is so that they can activate that stimulus proposition from long-term memory, and then practice having them write out what's the adaptive response to that. How do we want to respond to that particular situation? So we can be very clear about what it is they're trying to create, and then what they're trying to, and how they want to respond to that. Closely approximate actual movement. This comes from that functional equivalence theory. So timing, we talk about access similar parts of our brain that are involved with motor control perception. So then we want to make sure imagery is pretty similar to how we're going to experience when we physically produce something. So the timing of it, our perspective of it, so having a first-person perspective, like we're actually performing the skill live. The environment, any emotional aspects, again, trying to closely approximate as best as we can the actual movement performances. And then lastly, kind of incorporating these multiple senses. So we kind of talked about that first definition of imagery, that it's this kind of polysensory experience. And so if we're going to get the best benefits of it, and again, being able to make sure we're accessing all those brain regions that are involved when we are picturing something, we also want to make sure they're including all of these senses as well to help them facilitate the acquisition of this particular skill. All right, that's it. Any questions? Yes?
In terms of, you spoke about physical therapy a few times. I don't know if that was a broad category or if that was actually therapy by a physical therapist. But one of the ideas that kind of popped into my mind as you were talking about it is, along the imagery lines, is maybe treatment in the athletic training room for athletic-related injuries is more accurate in terms of the image, the feel, and the coaches and the team than treatment in a separate setting. So just a
So in terms of them practicing in a separate setting?
No, yeah, so do they go off-site, go to a therapy clinic for 6-month ACL?
Yeah.
Or they train with the coaches, athletes, and the sounds, smells, feel in that 6-month program?
So it definitely, one of the things that a lot of the research is finding now is you have people actually do it in the setting. It's much more adaptive and much more easier to kind of recall those scenarios, the smells and whatnot. It's just easier, you're there. You don't have to try as hard versus if you're somewhere else, you have to think about all kind of the environment of it. It just adds more cognitive load to your ability to produce that image versus if you're already there.
So I see that as as a benefit, I guess, to an athletic trainer to utilize their athletic training, and maybe even as an educational tool for non-athletic training settings to replicate, to try to replicate what they might get.
Yeah.
Going back to the ACL, when you were talking about, is there any research, or I guess in your opinion, of it being more or less beneficial when you introduce it in, like, I guess, the phase in which they're in, or whether it's motor or cognitive, depending on how they're kind of progressing through?
Yeah, that's a good question. So in that study, the one study where they didn't show the benefits to strength, they introduced it 1 month post-surgery. So it's kind of like, okay, here you're kind of now starting some stuff. We're going to give you this particular skill. We're going to train. And one study that actually showed a benefit, it was even prior before surgery. So they started working on developing that skill on how to use it, and then they kind of adapted to where they were in terms of what they were doing in terms of their rehab progress.
So starting it before surgery, and then like once they start getting like strengthening phase and kind of adapting it, and then like return to play, definitely
Right.
past that.
So depending on what stage you are, you would then make it permanent to wherever they're at. I think the one reason why they might have better benefit is because it is a skill, so they start early on just training the skill set, particularly for those that weren't using it, and then they can then make it more specific to where they're at.
I had a question about that, going back to the ACL thing.
Sure.
This is me just being totally neurotic, and I apologize.
Sure.
But, I mean, to me, I get what you're saying, and it makes sense. But, like, obviously with ACLs, everyone in here who's rehabbing or student with an ACL, going back to the integrity thing, I think my biggest question with that, and it's getting kind of gnawing at me, is it's a question about the research. Was there something that said who, if the same surgeon did did everybody
That I don't know.
reconstruction?
That I don't know if
Was
they,
it, you know,
I have to look back at the paper to see if it was the same surgeon. I'm going to probably guess not. They did have, 13 to 8. They had some individual variability within both those groups. So that would be a good question to look at to see if that is in fact the case. So I can't answer that question.
Sorry, and again,
No, it's a good question.
being neurotic.
It's a good question.
So I guess my question is, we can, as the athletic trainers, we can get in a philosophical discussion about this for isokinetic. So obviously, as athletic trainers, sports medicine professionals, we know there's no single athletic movement sport that is single planar flexion extension. So that's not really functional for our athlete to go back to sport. So is there, I guess, would it be too complex? Or are there any research out there about that return to play? Because yeah, we can get our strength back in 6 months,
Yep.
but it may be more of like an 8-9 month return to play because of that functional sport. So as an athletic trainer, that's where imagery would make sense to come in, not the strength itself, because you can train a kid to squat 200-300 pounds, but getting them to cut again, to have faith in that knee that it's not going to give out on them post surgery. Is there any research like that going on that you can?
So there is some stuff that looks at like fear of re-injury that people look at in terms of, it's more like self-efficacy, but it's self-report, right? So it's hard to kind of assess that objectively in terms of like confidence. There might be some measures that you can get to. The research that looks at like those psychological constructs generally show that people do feel more confident. So again, it comes back to practicing that stuff in their long-term memory, being able to now kind of re-implant like a better type of feeling, more confidence, less fear in terms of what they're doing, lower their anxiety a bit. So there seems to be a benefit of doing that. Again, that's self-report. So it could be a combination of things, right? It could be that, well, you introduce something to me, I give you the skill, so now I feel like I should be better. So you have to take those questionnaires at face value. In terms of like objective measures in terms of return to play, it's a little bit harder to start assessing those, because then you have to like have very specific objective measures like the isokinetic knee strength test. That's very measurable, right? I can get an exact measurement in terms of what's going on there. So it's a little bit harder to do that because of some of those individual variabilities. So oftentimes what they do, a couple ways to assess that is either qualitative stuff, so they'll just ask people in terms of interviews, like how are you using this? And it's definitely part of their returning to play or dealing with fear or dealing with, like in gymnastics, there's been a couple articles that looked at like really traumatic injuries and then being able to using imagery to kind of get over that, and then helping themselves get back into competition. So that would be kind of an area to kind of implement it to help them in terms of reducing some of those fears or anxiety. I mean, imagery, some of the base of imagery too is in just clinical psychology of using it as a treatment. A lot of like the stimulus inoculation stuff is imagery, kind of getting us different exposures, thinking about it at different levels, and then finally then being exposed to the actual stimuli that we might find kind of fear-inducing.
Do you have, or can you show us some place that we can go to kind of, like you said, you know, if you don't have the skill, you can't really build on it. You just gotta image something static and orange tennis ball.
Yep.
Is there any place we can go to kind of learn how to build the steps up? You know what I'm saying? It's just like a rehab. You start with this place and your goal is here to kind of, because I mean, if you wouldn't have mentioned anything, I would have gone in with my guy, and like, I sit here and think about doing this squat. You know what I'm saying? Like, I don't know what it sounds like, and I'm not trying to.
No,
Is there any place we can go to learn how to do this instead of just going like, close your eyes and picture yourself? Sit down.
So one, I 100% agree with you because I think that's what most people do. And coaches do the same thing. Like, I tell them to go image. And like some of the teams that I do some stuff where, oh yeah, I tell them to use imagery. I'm like, well, how do you tell them to use imagery? And what are they doing with it? And so oftentimes it's like, well, I just tell them. And that's not sufficient because there's a skill. Like if we were to assess everybody in this room, there are some objective measures to see what's your imagery ability? How well are you doing this? And if we're honest, people are going to have various levels. And usually if you have a lower level, you're not going to get the most out of it. Like, kind of a joke aside, but like I've had athletes in the past and be like, I don't see anything. Like I can't picture anything. Like I'd say like, okay, like describe your mom or whatever, think about that. And be like, I have a blank image, and I'd be always joking like, well, then how do you find them when they're like in the room? If you don't know what they look like, you can't re-experience that particular image. But it is something they can develop, right? So what I can do is, for those steps, there are some basic things that you can do. And I'll give you my card, and you send me an email, but I'll send you some material. I guess I can send you some material that you can send out.
And blast it out.
That will probably be easier. In terms of some basic things you want to reinforce, and some basic skills, some basic skills that they can first start. And it's really oftentimes just kind of like a basic script that you can take and work. Like, okay, here are a few things you're going to first work toward. When you can do A, let me know. When this feels comfortable to you, then we're going to move to the intermediate thing. Okay, then when you get that, then we kind of move to see it becomes more complex until they get to where like, okay, I feel comfortable with this skill. Then you start adapting it specifically to maybe something that you want to train. Okay, let's take what we're working on and let's think about like the circumstances surrounding that. What do we want to do here? Let's come up together. Usually what I do is kind of have that athlete or person talk about like, this is how I experience this is what I want to experience. Okay, then let's finally write that out once we've kind of harnessed the skill a little bit better to where they can kind of really produce these images that are effective for them. So I can send out.
Thanks.
Kind of going off of that a bit, I remember somewhere back in one of the classes we took talking about the difference between guided imagery as opposed to individual. So knowing what you're saying, how can talk to them, is it beneficial in those early stages to use more guided, kind of talk them through it?
Yeah, guided. So particularly early on, it's harder for them to kind of come up with something on their own. And usually they'll end up saying like, it's harder, it takes all my attention to think about what I'm going to do next that I can't just think about what I'm going to do. So if you can kind of guide them and they just passively listen to what's going on, early on it's much easier to do that. So I did, a couple of years ago, I did a study where I interviewed Olympic divers. And some of those people were like, I got to the point where I didn't need anybody to tell me, it was like autopilot. I got up there, experienced, okay, this is what the crowd is going to look like, this is how I'm going to feel, here's where the competitors, I know this. And like, I didn't need anybody to tell me what to do. I can kind of do it, and listening to something kind of got in the way. Because like, I wasn't there yet. Like, I needed to step back, and I needed to kind of recompose myself, and so it needed to be more self-paced. But early on, it seems like it'd be much more beneficial to be more of a passive person, and then create some of those scripts for them.
Has anybody looked to see if there's a correlation between imagery and imagery and injury prevention?
That I don't know. I'd have to look into that. I'd have to see if there's actually any research on imagery and prevention? It's a question.
Is first person or third person imagery or combination more beneficial?
It used to be people would say do both, but it seems like it's trending now to say first person because it's more equivalent to what you're actually doing. So, and it's also oftentimes easier. Like if you ask people just to image, most people adopt the first person perspective anyways, because that's what they're familiar with. And so if you think about it from that neurological side, if we want to approximate physical practice, it doesn't make sense completely to take a third person perspective. Now I say that with some caution because when it comes to like form stuff, there is some research that suggests taking that external kind of perspective and be able to see myself, like how my body, and particularly like for like sports that require, you know, manipulation of our body, like gymnastics and diving, there does seem to be some benefits to kind of step outside themselves. But I've gotten to the point where, and this is my opinion, this is not research per se, that you have to be pretty skilled to do that because it can be very complex and hard to do. We don't typically really watch ourselves unless we have access to video to be able to kind of produce that realistic image. So in my opinion, I've kind of shied away from that unless they're really good. If I have an athlete that's like, hey, they're really good at this and it's like really easy for them to do, then I'd probably start introducing some of those other things if it was related to what they were trying to acquire, like a form thing. Okay, I'm trying to do this, then it might make some sense to kind of take a third person perspective. Dr. Murray? The answer is no.
I'm kind of thinking about some of the injury aspects here a little bit, and when I think about imagery and when you're describing it and so forth, you know, we're trying to train the mind to get the body to do more.
Yeah.
But then I think about catastrophic injuries. So someone that's we use a top-rated athlete that has just going down the ski slopes and a catastrophic wipeout occurs. And so when you're going through that, the body in some respects retrains the mind. Because you start playing that over and over and you see it. And then if it is in the media, you watch it on TV and if it's had a catastrophic impact, I'm thinking how the body now is retraining the mind back to the fear aspect. But we've really trained it in an imagery fashion. You know, you hear people talk about, I've been going over this 1,000 times in my mind, and you're really reliving that to such a point that you retrain the mind, so then it's like, you can't get back out there and function the way you did. And, and so how do we take that? And so you have a baseline where they're already really good, right? You're trying to do imagery to make them better. But this accident occurs, so now we're down here. We first got to get them back to baseline before we get them back up here. Many times we can't even get them back to baseline.
So in that kind of scenario, right, we think about it in terms of what's stored in memory right now, and oftentimes that does happen, right? We're kind of stuck in a certain situation. So by changing their perspective a little bit, and usually in those scenarios, there's not a ton of research on this, but there are some research on how you supplement those images, where you have them do some basic skill sets where they're successful at. And you have them first really just focus on those basic skills. So as they're returning, or if they're not ready to do a very complex movement yet, we'll start with something that they are able to do and they're comfortable doing. And then have them just image that. So they get, again, kind of raise their confidence, like, okay, I can do this. I'm now kind of putting in my mind's eye these successful experiences. And then we kind of slowly progress to where we hopefully kind of replace that prior negative memory with something that's more adaptive. It's hard though, it's a tough process and usually a little bit longer process because if it's a very strong experience, a very catastrophic, it's not easily forgettable. But I think with time, and this comes more from the clinical side of like very traumatic experiences, you can replace some of those things with more kind of helpful, adaptive types of responses. So for example, something happened to me when I came into a room that was dark. Every time I go in that situation, I might get a little bit of a flashback of like a fear. But if you can kind of then practice supplementing like, okay, most likely this is going to be kind of a safe experience, and then eventually will help at least reduce that fear that one might have at a higher level early on. So yes, it's tough, but it is possible by kind of starting small and then kind of building more complex.
Have you seen anything else? Relate back to what you were talking about earlier on the integrity and so forth. You know, after an ACL or other types of injuries, oftentimes braces are used for the athletes, and whether they're absolutely necessary or not sometimes is always debated in in some cases, but many will wear it as a crutch in some situations, and then they feel that's better. But I was curious if there's ever been anything that you've seen in the research where, you know, by utilizing imagery, it's helped people get past the utilization of a brace when it's not absolutely necessary.
Nothing that I know off the top of my head. Now, there's hundreds of studies that, you know, I don't know all of them, but I don't know if there's anything in terms of looking at things like crutches, like kind of that idea, like it's there, I don't need it, but it makes me feel good. So I don't know of anything that's specifically trying to look at how would you either remove that crutch or remove that aid. But it'd be interesting, I guess, to look at.
That's what I would basically say, ask.
Well, I knew you were, so.
Any other questions?
I don't know if it goes back to the ACL, but it looks like they weren't really testing, or they weren't looking at a functional movement. They were looking at strength, just the quantity.
Yeah.
Correct?
So for the strength stuff, yeah, it was just really an output. They just did like the side backs machine, like a extension flexion type of movement, and then looking at kind of pre-post.
Because I have seen some stuff that suggests that people that have better co-contraction during early ACL rehab have less laxity later on. So maybe if they're acquiring that skill in a better way in contracting multiple muscle groups, maybe they're not exposing the ligament to multiple stresses that actually cause laxity. That would be something I would.
Yeah, no, that's a good point. The niche, well, in terms of the integrity, what that was really knee laxity. That's what they were looking at. That's what they measured. And so the combination of that additional part of the imagery kind of reduced knee laxity compared to the control. So it was significantly less than just kind of doing the kind of traditional, whatever they had as traditional rehab, but that's a good point.
This might not necessarily have much to do with imagery, but I kind of had a thought about pain and in relation to catastrophic injury. A lot of times it's manifested psychologically, and a big breakthrough in rehab was gaining that trust to trust the body part to do what it needs. And if you're familiar with any specific techniques or even imagery techniques to overcome that psychological pain, because they might not have physical pain, but they are expecting pain to happen in certain capacities. So if you're familiar with anything related to that.
So, I mean, obviously it's a tough one, like when you have a perception of something or an expectation something's going to happen, and first kind of starts with changing those expectations. I don't know anything specific in terms of like interventions using imagery for that, but I don't see why it wouldn't be something that could apply to those scenarios. And you have other mental skills like the self-talk stuff that will help us in terms of changing our cognitions towards it. If we can change our cognitions a little bit towards it, then it kind of changes our behaviors a little bit, which helps. Does that necessarily always reduce the pain? But not necessarily, but if we can change our expectations ahead of time, that might help us like prepare for more realistic what's going to occur rather than this expectation of like it's going to be really painful. So I would probably start like adjusting expectations first and foremost. There's other obviously hundreds of different types of mental training techniques that you can apply. Imagery would make sense in that scenario where if you could get them to see, okay, I'm doing this kind of freely, easy, within the lower pain threshold, and kind of again, it's kind of supplementing that long-term memory. We want to adjust that. Like kind of now we have this new experience of like, what is reality now? Like I'm not where I was when I first maybe started off. So if I can then build that, build that memory to make it stronger, it might make it easier for them to then trust themselves to say, okay, like I've done this, I've experienced myself doing it. I always give kind of the example of like deja vu when you think about it in terms of imagery. If you get really good at it, that's exactly what you want to have happen. Like I've already done this. It's in my head, I've seen it. Now I just kind of adjust to it. And in that kind of settings as well, you can produce something where it's like, okay, I'm going to experience more of a pleasant type of situation than maybe what I've done in the past. So I've kind of replaced that, maybe unhelpful or kind of maladaptive behavior with a new, more effective